I have with me here the famous Rachel Bourne, who is one of the top nurses at Utah Valley Regional Medical Center. Rachel, how are you?
I'm well, Amy, thank you.
Good, and thank you so much for being here with us.
Oh, you're welcome.
And I understand you've been at Utah Valley Regional for some time, is that right?
I have for 7 years. As soon as I
graduated
graduated nursing school, I applied there to the resident program, and I've been on the adult ICU unit ever since.
Okay, so if we have any type of intensive care as adults, you or one of your associates will be taking care of us.
Yes.
Okay, that's great. So tell me a little bit about yourself and a little bit more about what you do in the ICU.
There are a few ICUs at Utah Valley Regional Medical Center. There's a cardiac ICU, there is a neuroshock trauma ICU, and there is an adult ICU. And in the adult ICU, one of our specialties is caring for patients who have experienced a stroke.
Okay.
And so that's been a focus of ours over the past few years. And we've worked really hard to really focus on our education and in the best treatments to give to patients who have experienced a stroke.
Interesting. Okay, so as far as stroke goes, that's really near and dear to my heart because my dad had a major stroke about 2 years ago. And they took him in and they did an MRI, and they found that he had been having mini strokes for almost 10 years beforehand. And so it explains some of the symptoms that he had had. But I was wondering if you could explain to me a little bit about what a stroke really is. Like, what's the difference between a mini stroke and a big stroke?
Sure. Well, a stroke, another term we use for that is what we call a brain attack. People are familiar with the term heart attack. They know that a heart attack is when the blood supply to the heart muscle is compromised. And so part of that heart tissue dies. With a stroke, we call it brain attack because the same idea of that you have tissue or cells that are dying because the blood flow is compromised to a certain area of the brain. And that can be caused by two things. The most common is what we call an ischemic stroke. And so you either have a complete blockage of blood flow to a certain area of the brain or a lessening of the blood flow. So not as much blood and oxygen is getting to that area. A less common cause of stroke is what we call a hemorrhagic stroke. And it's basically a bleeding out of one of the blood vessels of your brain. And so that blood is diverted to another area of your brain and isn't getting exactly where it needs to go. I brought a little model of a brain here, and this just shows all the different blood vessels within your brain. This is your internal carotid artery, so the arteries that run up through here, and then feed the brain all over. So this is showing the outside, the meninges, the covering of the brain. This is the inside of the brain, and a stroke could basically occur anywhere in here. So anywhere you might get a clot or you might have bleeding out, any one of these areas would cause a stroke. And depending on where that clot or that bleeding out occurs depends on the kind of effects you're going to have from that stroke. And also depending on how long it takes until you're able to fix that would correlate to the severity of your symptoms afterwards.
So let me give you an example. So my dad had, before he had the stroke, he had a brain tumor. He had two different types of brain tumor, and it was by his brain stem. And at first they thought it was something called a KRE1 defect, but then they found later when the MRI imaging became better, they realized it was actually a tumor, and it was blocking. So that would be the first kind of stroke that you were talking about, where the blood flow is being blocked to the brain. Is that right?
Right.
Okay, and then the second, where it's bleeding out, would be more like a traumatic injury, like a
car
accident,
a traumatic brain injury, or someone maybe who has a burst aneurysm. Aneurysm is that outpocketing in an arterial wall where it's weaker, and if you have shearing forces, especially contributed by high blood pressure, if that aneurysm bursts and you have bleeding that goes out of there, if blood is flowing out of that aneurysm, it's not flowing to where it needs to go into the brain.
Okay. That's great information, and it's a little bit over my head, I have to admit, and that's why that's why you're the expert. So it's good to know that there is so much medicine behind it that we can identify and pinpoint exactly what's going on with it. So what are some of the risk factors for stroke?
There are some risk factors that unfortunately can't be mitigated, but thankfully there are some that we can change. Some things that we can't change are things like gender. Women are more likely than men to experience a stroke. over age of 55, you're more likely to experience that.
Women.
Race, African Americans are more likely than any other race to experience stroke. Family history of stroke as well.
Okay.
Those are all things that are risk factors that you cannot change.
Okay.
Fortunately, about 80% of strokes are preventable.
Really?
Yes.
Okay, now how is this possible? How are 80% preventable?
These are things that are generally contributed to lifestyle things.
Okay.
High cholesterol is a risk factor for stroke.
Really?
When you have high cholesterol, that can lead to plaque building up inside your arteries, and as plaque builds in, so if you imagine you have a blood vessel that's nice and big and blood can flow through that, you have high cholesterol, that plaque builds up inside and it makes it smaller. It's a smaller area for the blood to rush through and to deliver oxygen. You could also have something called a thrombus, and that's a blood clot that can build up right there, and that can either completely block the blood flow to your brain, or it can slow down the blood flow enough that you're not getting the adequate amount of oxygen you need to your brain tissue.
All right. So, Rachel, this is all really informative. What do we do if we think somebody we love is having a stroke? How do we tell, and then what do we do about it?
There is an acronym that has been developed to help us remember signs and symptoms that someone may be having a stroke, and that is BEFAST, B-E-F-A-S-T. The first B is balance. If you notice that someone seems like they're off balance, they're not quite walking the way that they normally do. E is for eyes. If they suddenly have a change of vision or lose vision in one or both eyes. F stands for face. You want to see if their face is symmetrical. Ask them to smile, to raise their eyebrows, puff out their cheeks. Make sure both sides of the faces are symmetrical in their movements. Arms, ask them to hold their arms out. Does one arm seem to be kind of drooping, or are they able to hold them out steady? Speech, ask them to repeat after you a really simple sentence. Does their speech sound slurred? Or are they having trouble repeating back to you the simple sentence that you said? The next thing is time. Note the time that these symptoms took place. We have a 3-hour window that we want to see those patients. Within 3 hours, we can give them special clot-busting medication to help break up that clot and reduce the severity of the stroke. If you see your family member have any of these symptoms, even just one symptom, call 911. Even if you're not sure, call 911. You'd rather be safe than sorry.
That's right.
And some people have the temptation, for any reason they think it's faster, it might save money, they have the temptation to want to drive their loved one to the hospital. It's really important that you call an ambulance. The ambulance can call ahead to the hospital, let them know you're coming, activate the stroke team. They can be ready for you right when you hit the ER doors. Also, if anything happens on the ride over there, maybe they have problems breathing, their airway is compromised, they can take care of that on the way over to the hospital. So remember the signs and symptoms with the acronym BEFAST, and call 911 and wait for the ambulance, exactly, to take you over to the emergency room.
Oh, that's really helpful information, because if I saw a loved one who was having a stroke, then I would definitely want to drive them immediately and not wait for the ambulance.
Right.
But it's great to know that actually you're doing more to help save, their quality of life by doing that.
Exactly.
So, okay, very interesting. Okay, so high cholesterol, high blood pressure, we kind of know that those are bad things. Is there anything that we might not think of that could help prevent strokes?
Some other things are just general immobility, and I know that's everyone kind of knows about that. We just need to move.
Get out and move and exercise.
Even just walking half an hour a day. Just walking increases your circulation, can help to lower your blood pressure. Obesity is a risk factor for stroke, so that will help to lower your chance of obesity. A few other things are smoking. When you smoke, it causes an increased likelihood that your blood is going to become sticky or cause clots. Also, high alcohol use has also been associated with increasing the risk of stroke.
Interesting. Rachel, thank you so much for being with us today. It was really a pleasure to have you.
Oh, you're so welcome. My pleasure to be here, Amy.
Thank you. We'd also like to thank our title sponsor, Orchard Park Post-Acute Rehab Hospital, for sponsoring this show. I'm Amy Osmond Cook, and thank you for being with us.